Welcome to the RD2BE podcast. Each week we sit down with a different registered dietitian nutritionist to showcase the diversity of opportunity in the dietetics profession. Our aim is to dismantle the notion that there is a traditional career path. I'm Carl Barnes, the registered dietitian behind the scenes of RD2BE.
And I am Jenna Warnock, the RD2BE host. Our RD guests share their stories, career paths, and advice to help students like us succeed in the profession. Welcome back to another week of the RD2BE podcast. I'm your host, Jenna, and this week we're super excited to feature a niche of dietetics that we haven't really had an opportunity to dive that much into on the podcast. And so we're super excited to feature Megan Moore. She's the owner of My Bariatric Dietitian, where she has experience in bariatrics in a clinical setting, and now she owns her own private practice where she helps people in a bariatric setting, both before and after surgery. And we're just super excited to sit down and talk to Megan about what she does, her experience, advice she has for you all. And so, Megan, thank you so much for sitting down to join us and talk about your journey.
I'm absolutely so happy to be here. Thank you so much.
Oh yeah, I'm super excited. I'll talk about it. And so first, we always like to just start guests off with this question of what sparked your interest to pursue dietetics in the first place?
Yeah. So I actually started in college with this idea that I was going to go to med school. And so took that like pre-med route, but was actually going to get a degree in genetics. So I actually started with a emphasis in genetics and was kind of working my way through that and actually kind of anticipated going potentially through the pre-med route, like with more of a research-based lens, and potentially kind of going more into research versus like working as a doctor, like in a hospital or something of that nature. But I love genetics. I thought it was so fascinating. But as I kind of got a little bit more into it, I wasn't really sure if that is the exact route I wanted to go. Like, I didn't know if I wanted to be like in a lab all day. I didn't know if I wanted to be like with test tubes and that sort of thing. But I actually took a class which really started to dive a lot into nutrigenomics and epigenetics. And I was like, oh my gosh, this is so cool. I was like, wow, like I can like tie the genetic component and there's like this food aspect. And I was like, this is my mind was blowing. And as I just started learning more and more about it and just seeing how we could really impact our health and our body by just what we ate, I actually started to dive more into the nutrition side of it and then realized that there's like a whole field out there that's just about nutrition and health and wellness. And I actually had a friend from high school who was specifically in like a dietetics focus path in college. And so I talked to her a little bit about it and I was like, yep, that's what I'm going to do. So I switched my major, which added an extra year onto my undergrad. But I loved all of it. Even like I loved the science part of it. I loved like anatomy and physiology. But I also loved all the, food science aspects of it too, and being able to learn the counseling aspects. And so it was definitely not my intention, but very happy I did it.
Oh yeah, and that's definitely a common thing that we hear from guests where they're like, I took this one class or I knew this one person and they just like mentioned off the cuff dietetics. And then it's like, so you mean to tell me I can just study this thing and have it be the thing that I study? And that's all, not all that there is because, there's so many things that you learn in dietetics. But yeah, and it definitely sounds like just every aspect of it was an interest of yours, which is really great. And it's always good to hear that it works out that way because, that extra year is worth it in the long run. And definitely with what you've been able to do in your career and the business that you built and what you do, definitely fulfilling in the long run. And so prior to you going into bariatrics, you initially worked in a skilled nursing facility. And so kind of how did that progress from working in a SNF to going into bariatrics? Like what did your transition look like from getting into the bariatric space?
Yeah. So when I was actually in my internship, I got really lucky because my internship was about 40 minutes away from where my family lives and where I grew up. And one of my best friends from college lived literally like right where my internship was. And so I actually just moved in with her. after college, and so I could do my internship, and it was, I mean, it really was fantastic. But when I was living with her, she actually had bariatric surgery. And I don't know how it is nowadays, but when I was in school, um, by the way, that's like a statement I never thought I would say, like back in my day. But truly, like we didn't get any like really bariatric education at all. And so when she was going through this, I was kind of just like, I don't what is this? Like, what are you going through? Are you sure you like want to do this? Like, what is this? But it just so happened that like right around the same time was when I was going to do my rotation at a VA hospital for bariatrics. And so it was really interesting to see like her process of like going through surgery. And she was also having the sleeve gastrectomy, which at the time, this was, by the way, back in 2009. So quite a while ago. But when she was having the gastric sleeve surgery, this was kind of the beginning of this like new procedure. And so while forms of it had been around for a while, a lot of people at the time were still very used to like either bypass or lap band, right? So like the sleeve itself was like very new. So I just even remember asking her um, like, do they put like a sleeve on your stomach? Like, what is this? So I was learning a lot myself, like going through my internship and then like living with her and seeing obviously like the whole process of it was just like very eye-opening. But it still took a while for me to like, like kind of grasp this whole concept and like just to even see the impact that it would have on her life, right? Like even that transformation process takes months, if not years, right? For some people. So it was still kind of new to me. And anyways, she was doing well and I learned some in my rotation. And then this was like right around, so 2009 was right around like the housing crisis, right? So like the economy was awful. I passed my exam and all that good stuff. And it was kind of like, just get a job. Just get anything, like whether you are interested or not, like it's experience, just get a job. And so I found a job at a skilled nursing facility and it was a great experience. I got tons of clinical experience. I basically was the sole dietitian for, I rotated between like 2 to 3 facilities, depending on the year, and had hundreds of patients for myself. So, huge learning curve, learned a lot. But after a few years, I just realized it wasn't my personal, you know, passion. So I started looking around at jobs, and a job became open at a bariatric clinic, actually, like a private practice one. And of course, by this point in time, I had seen the transformation that my friend had gone through and the impact that it had on her life. And, after working in a skilled nursing facility where everyone was at the end of their life and like dealing with a lot of chronic disease, right? And whatnot, I saw my friend who at the time was obviously in her 20s and living her best life and totally seeing like a change in her health and quality of life and just like, right. I was like, I think I'm ready to go to the other side of the spectrum and like work with helping people either change their health and quality of life or prevent, right, that progression of chronic disease. And so luckily I got the job, and truly like everything that I've learned about bariatrics has been from that experience. So working with the other dietitians, working with patients, again, it like wasn't something that, I was like really like quote unquote taught on outside of like a few weeks of my internship and like maybe a few paragraphs from a book that I read in college.
Yeah.
So yeah, kind of an interesting experience to go that way.
Yeah, and I'm honestly glad that you kind of mentioned how like just societal impact had on the like because you had exposure to bariatrics in like with your friend and during the rotation you had with the VA before your first job in the SNF, but when you were just honest and blatantly just like it was a housing crisis. I got to do what I got to do and I got to pay the bills. Even if you had that experience in bariatrics, you knew like your decision and how your career progressed, it's like environmental or societal impact can influence the direction that your job makes, but you also didn't like let bariatrics just like sweep away and you never touch it again. It was very much like you saw the situation that you were in because of the housing crisis, did what you had to do in that moment. You still got a lot of great experience from working in a SNF. That definitely helped probably prime you for that bariatrics dietitian role. And so even though it was kind of like you were in that situation in 2009 where it was like, well, even though, SNF isn't at the top of people's lists, I'm sure, as like lifelong careers, it was still, like with what you said, a great experience and primed you really good. And I'm just mainly wanting to highlight that because just how it says, like, you may not have every outlook in life or every career point in life planned, but you can still get great things out of it and it can still help pivot you to what your main interest is. And in that case, for you, it was bariatrics. And so, kind of then going into and progressing along your little career journey to your role as a dietitian in that bariatric clinic. And so, kind of for people or people listening that may not be familiar with what a bariatric dietitian does, can you kind of describe like where in the process of bariatric surgery is a dietitian involved, what you do like pre, post surgery, just kind of look at all, the things that you maybe only got a paragraph to read in undergrad, what you kind of wish you could have gotten more like knowledge about with bariatrics as a dietitian?
Yeah, bariatrics is like such a amazing field, and obviously it's becoming more and more well known over the years. But really, like the bariatric dietitian or the dietitian is like an incredibly vital piece to the whole bariatric journey. And so every surgical team, every surgical clinic, and there can be like private practice bariatric clinics, there can be hospital-based bariatric clinics, or even kind of like a mesh of the two, where sometimes a surgeon will still perform surgeries at a hospital, but they don't work for the hospital. So, the journey to get to surgery, and then especially the journey after the surgery, is incredibly like reliant on the dietitian. So generally speaking, the dietitian will work with a patient before surgery at least once. And it does depend a little bit on the surgeon or the surgeon center and like their protocols, but it also just depends on like insurance, you know, credentialing and or I should say like insurance approvals, right? Like what they require for patients to go through. So sometimes there's just like one visit, and sometimes there's like 3 or 6 months worth of visits that are needed for someone to be approved for surgery. But generally, like that, if it's just one session, that dietitian visit is really for education. So giving them a lot of education about the surgery itself and the anatomical changes and hormonal and metabolic changes that are happening, and then how that will impact what, when, and how they eat after surgery. So there's definitely kind of this like intro session, right? And you're getting to learn a little bit more about the patient themselves too, because maybe they have certain goals, maybe they have certain health conditions, right? Maybe they have certain dietary preferences or intolerances or allergies that you need to take into consideration while you're providing your education. So like an example of that might be if someone is vegetarian or vegan, right? There's this huge emphasis on protein after surgery. So you might tailor your conversation to be more suited to discussing those types of protein sources and how they can support their needs. So it's a very like introductory general type of consultation. But again, sometimes you're meeting with them more than once. And that's where you can dive into a lot of other topics too, and dive a little deeper into nutrition or talk about meal planning or talk about, even just goal setting and all kinds of stuff. So, but that's the dietitian is definitely integral for that piece. And then post-op, this patient is going through a very dramatic change to their body and their life. And so They transition post-operatively through a series of diet phases, usually like liquids to purees to soft food back to like a solid regular texture. And so you're providing education and support through that process. But then they're obviously also having a dramatic change to their portion sizes and how much they can fit into their stomach and their nutritional needs. And so you're really helping them, through those first few months, like navigate the challenges and even the potential side effects of having surgery. Sometimes that's, nausea, or maybe they're having some GI issues. And so you're providing a lot of education and ongoing support. And then really, because it also is a lifestyle change, right? Behavior change has to happen too. And so you're working with them to help them actually transform, behaviors in their whole lifestyle so that they're not just reaching their goals, right? And working towards health improvement, but like they're finding lasting change as well. So the dietitian is so important. It's not to say that every single surgical center out there has that fantastic program to be able to support their patients. That's honestly like where there's a huge hole in the system, is that a lot of times people will have the surgery and then they don't have access to any kind of nutrition support or dietitian care. But it's definitely like we see so, it's just such great outcomes and improvements when people do get that nutrition support. So yeah, I would say, out of the team, obviously there's the surgeons and the nurses and the physician's assistants and uh, the ARNPs, and they're all great. But then really like you have like a psychologist, you have a dietitian, and sometimes even exercise specialists, physical therapists, sometimes they're on the teams as well. So it's really this like comprehensive team that's helping each individual. But I would say the dietitian is like such an integral part to all of that, which is really fun.
Oh yeah, no, definitely. Because and then a kind of follow-up question I have to that is, are you seen as an integral part of the team, and are you given the tools and the recognition as being an integral part of the team? Because, there's that misconception and just conception, especially in the clinical dietitian space, where it's like you're in those cubicles in the basement, just tacked on to the cafeteria, and just you're kind of stuck in that little cubicle box. And so, kind of going into, yeah, your role, scope of practice, do you feel, in your experience in bariatrics, because again, you can't speak on every bariatric clinic in America, but do you feel like
Yeah.
in your experience being a bariatric dietitian that you were recognized as an integral part of the team, and that you were able to truly push the breadth of your scope and what you were able to do for the patients?
So I've been lucky and fortunate enough to work with I was before working for myself, obviously, working with a few different surgical centers and hospital programs. And I can say that most of the time, yes, you are seen as a very integral part. And so like the surgeons or, the other staff love to refer to the dietitian. They always want to hear your input on patients. And I think I've also just been really lucky to work with such great team members over the years who really valued and respected, my expertise. However, I have had those moments where it was the opposite, right? Where maybe the surgeon, it was like their way or the highway kind of thing, and they weren't really interested in you. So I would say that, every program is going to be a little bit different. But from most of the people that I've worked with, and even most of the conferences that I've been to, so like even like the Obesity Medicine Association, which is still a little bit more medically weight loss focused, but does have that they do have kind of that surgery aspect to them as well. And definitely the American Society of Metabolic and Bariatric Surgery, ASMBS. I mean, nutrition is definitely like a huge place in that as well. So yes, I would say most of the time, surgeons and the other team members love the dietitians, and really, really, respect you and want your input in things. But I know that's not always the case. So, I think that I just got really lucky. But I think that there's a lot of an amazing, team members out there that would be very, very supportive and respectful of the bariatric dietitian. But there's always those bad eggs out there. So
Yeah, and I feel like another part of it too is like a lot of people just don't know how, and not just how important, but also how knowledgeable and the expertise that dietitians are supposed to bring.
yeah.
And so I do feel like with having some of those surgeons or those people on the team where they're like, "Oh, I know the best. I am going to do it my way because my way's always worked." Well, sometimes it might just be a gentle nudge of like, "Hey, I am specialized in this," or just kind of being like, "I was trained for now it'll be 6+ years to do," like, because it's kind of just maybe those gentle nudges or things like that. But again, there's always going to be those people that you will have to encounter or deal with, but also having that reminder of standing your ground in the sense of, if you do have the opportunity to educate them on what you can do, your position and things like that, I mean, that would definitely benefit everyone all around. But I'm glad that you mentioned both like the positive aspect, but also just the reality of you're going to have some people who just don't know or don't understand or value what a dietitian does. And then sometimes it'll be up to you to be the one that kind of like clears up those cobwebs or like lets them
Mhm.
know what a dietitian does and things like that, because advocacy is also on your end. But yeah, I just like bringing up that question, especially in a clinical stance, like in a clinical stance, especially in bariatrics, as to your insights into how the dietitian is viewed, how other people in the interdisciplinary team that you work with view the dietitian. And it definitely sounds like you were represented as an integral part from both beginning and post surgery, which is really good. And kind of going more into bariatrics itself, like, because you did describe like the surgery and just kind of what happens a little bit, where it's like their stomach is shrunk and how there's different types of surgery aspects that they can have in bariatrics. But kind of going off of your experience, are there common misconceptions that you saw working in the clinic, whether it was with patients or just with the practice, or things that you had to address regarding bariatrics, or if there were common, because you kind of mentioned how nausea was one thing, but if there were just common misconceptions that you kind of had to address while working in bariatrics, or common problems with patients that you had to address?
Yeah, and I think like the misconceptions come from both sides, where there's misconceptions from the general population, right? Like what bariatric surgery is and what that means. And then I think there's also misconceptions when patients actually come in to get surgery, um, you know, what it could mean too. So, I mean, just from a societal standpoint, I think that there's still this reputation of surgery just being the easy way out, right? And you're cheating, right? Um, and that's so far from the truth. I won't go on my whole soapbox about that, but I would say that's probably like the most common misconception from the general public, right? It's just this idea of like cheating, taking the easy way out. But I think for some individuals, obviously they come into surgery, the surgical process, and many of them have done a lot of research themselves. They might have known other people who've had the surgery. And, with social media these days, they've potentially been exposed to, other patients and their journeys online, even if they don't know them personally. So there's a lot more exposure these days, but I think some of the most common misconceptions are that, um, you know, number one, if you lose weight that first year, like you're going to gain it all back, right? There's this like fear of not being successful or only temporarily being successful. And so there's always those people that come in who are like, hey, my friend had this, and I really want to do this, but like she gained all her weight back. So am I going to do that? And while some like kind of rebound weight gain is not uncommon, that happens to most people, like totally regaining all of your weight is like not, we don't see that as often. It can happen, but we don't see that as often. There's also, the misconception that like you can just like stretch your stomach back to its full size after surgery. That is total myth. I've also heard things like, you can only eat 2 bites of food and you're going to be full and you can never eat more than that for like the rest of your life. And that's not true. Um, or you're going to have like a ton of intolerances. You're never going to be able to eat anything. You're going to live off of like shakes for the rest of your life. And that's not true. Um, so I think that there's tons of misconceptions about surgery out there. And that's why it's so important to get, obviously, to have a great team and to ask a lot of questions and to do a lot of research. But, one of the things that I love to do with a lot of my clients early on too is like dispel a lot of the myths, right? And give them more information about if you are asked to do something either temporarily or long-term after surgery, like I like to explain why, right? So it's not just like this blanket statement and people don't understand. And honestly, a lot of the guidance after surgery can be very individualized too. So even if you hear like these like blanket statements, it might not, or blanket recommendations, it might not apply to you, right? Or maybe there's some adjustments that need to be made. So yeah, there are a lot of misconceptions, or even like the idea that like, you're going to like wither away and like be so malnourished. I remember my first experience in my dietetic internship with bariatrics was seeing a woman who had, I think it was like gastric bypass, like at this point, probably like 30 years ago or more, and was so malnourished. She was in the ICU. We called her like a frequent flyer because she was always like popping back into the hospital. And I was like, oh my gosh, this is terrible. Like, do all bariatric surgery patients experience this extreme malnutrition and just like wither away? And while there's obviously a high risk for that, especially in certain surgeries, that's not what we generally see. So yeah, there's a lot of misconceptions out there. I could probably spend a whole hour talking about all of them, but that's honestly things that I had to learn about too as I got into the field. So
Yeah, and it's definitely, I feel like, because from what it sounds like, yes, there are like standardized bariatric surgeries that all patients can have. However, the outcomes are very individualized. And so just because you see one patient have this outcome doesn't mean it's the same outcome that every patient will have. Thing to share. But yeah, kind of going back to with what you said, where there's that perception where bariatrics is the easy way out, and it's just seen as the just you were too lazy to do anything beforehand, and so this is just you cutting corners to get the same outcome as other people. Is there anything that you would offer? Because if someone had this perception, or just to kind of enlighten people who may not be aware with bariatrics, kind of what makes people qualify for bariatrics, just kind of what are the types of people going into these surgeries? I think that's just a good question that I'd want to ask to kind of help clarify for people who may be listening, like who are the people that are going into bariatric surgery and what's their past history with weight management or trying to lose weight, just kind of giving some insight into the patients that you've had pre-surgery, and kind of what with your experience knowing that that myth is completely false in the sense of
yeah.
everything about it.
Yeah. So generally speaking, I mean, more and more these days, insurance is covering, parts or all of surgery for individuals. And so there usually is insurance criteria that individuals have to meet to be able to get that approval through their insurance to get some type of coverage for these operations or procedures. And, generally speaking, that is based off of BMI and comorbidities. Some individuals will qualify for these procedures from BMI alone. And then if their BMI is a little bit lower, sometimes they need one or two comorbidities to actually qualify them for surgery at that lower BMI number. But, for many of these individuals, I would say many of them have spent potentially years, if not their entire lives, struggling with their weight, right? And we know obesity is a chronic disease, right? And so we haven't been doing this as a society, but I think that there is definitely this push towards treating it as a chronic disease, right? So just like we would treat cancer, just like we would treat diabetes, just like we would treat, other types of diseases, that's how we really want to be addressing obesity as well. And so this isn't just about weight, right? Many individuals who go into wanting these procedures certainly do want to lose weight, but many of them want to do it for a multitude of reasons, right? Of course, they want to feel good and feel confident and like look and feel like their best self, whatever that is. But many individuals are trying to reverse or prevent chronic diseases. Many of them are trying to really improve their quality of life. They're trying to improve their activity level. They're trying to, live longer. They want to be more comfortable. They want to have less pain, right? And so when they're given that opportunity to have a tool that works synergistically with, diet and lifestyle changes, it just helps them not only get to where they want to be, but also have a higher likelihood of being able to stay there too and maintain it. And so again, like these individuals, it's not like they you know, gained weight yesterday. They're just looking for like this quick fix. Like they have potentially spent years, if not decades, dealing with chronic health issues or their weight, right? And we know that that can really play into someone's mental health, right? It can impact their life in a lot of ways. I mean, there's definitely like just societal factors that go into that too, and acceptance of people at different body sizes. And so, yeah, I mean, a lot of these individuals, they're not just looking for, again, like a quick fix where they just like, have have major surgery and just like do whatever they want. Like they're really looking to completely change their lives, right? Um, and there can be a lot to that too, from psychological behavior changes to diet and lifestyle changes. But, there's a lot of different types of individuals, obviously, that are going through surgery, but there's usually a huge qualification process just to even get to the point where you can have surgery.
Yeah, and I'm glad that you kind of focus just on the pre-surgery aspect and the patients that are coming into the surgery and the fact of typically people who are going into something wanting a quick fix. That quick fix is typically to, I want to keep doing everything that I was doing before, but have this very specific outcome that I want without me having to change everything. Where if you look at bariatrics just from a bird's eye view, they're literally flipping their entire life and how they function, their lifestyle behavior completely upside down. And so as far as it being a shortcut or it being a quick, fast, easy way to achieve a certain weight or a look that um, it's just if you look at bariatrics for what it is, what it does, and the post-surgery modifications that they have to make, it is definitely not a quick fix, and it's definitely a lifestyle change. And I'm just glad that you kind of outlined that just because again like with what you said there's that common misconception towards bariatrics and really our role as dietitians if someone is interested in bariatrics or if someone goes into bariatrics it's good to kind of get those misconceptions cleared up or just kind of understood beforehand so that whenever you do experience these patients that you're not going to be seeing them as oh they're just lazy or oh they didn't try hard enough it's like you want to go in compassionate understanding and being like they're choosing to do this because they most likely tried every other option in the book for like years and none of them worked and so it's kind of like bariatrics if I'm hearing correctly is definitely not the first choice as far as weight loss goes and it's because of how impactful of a decision it is and how it like completely alters their life. And so, yeah, I do appreciate you highlighting and sharing just kind of your experience as a dietitian in that space and types of patients that you see. And so kind of
Can I add to that real
yeah, no,
fast?
no, go for it. Yeah.
So I also just like to point out that, you know, a lot of my patients are some of the hardest working people that I've ever met in terms of like trying to improve their health, right? Like they're not lazy at all. They have done everything under the sun and they continuously try to get to their goals, right? And so they've done the research, they've tried everything, and it's not a lack of motivation or willpower, right? It's that we just know the diets don't work too, right? And we also have to think about the process of behavior change. And many people aren't taught that as well. So they might be given like a meal plan, right? Follow this 30-day meal plan. But if they're not educated on the science of nutrition, if they're not educated on the psychology of behavior change, right? There's aspects of our quote unquote diet culture, right, that are just automatically setting people up for failure because they're never learning the why behind what they're, how to take care of their body, how their body actually works. And they're also not learning like the process of evolving, behaviors and habits in a way that's really supportive of the goals that they want to achieve too. So, but yeah, I mean, these individuals are not they're not lazy. They're, if anything, they're sick of working so hard, you know? And like, it's just like with any other chronic disease, whether that's like type 2 diabetes, right? I mean, we give people medications, we give them the tools to be able to manage their disease. And yes, as dietitians, like we love to swoop in there and provide that nutrition support too, to maybe even help them get to a place where they don't need medication anymore, right? But we wouldn't just, not offer somebody those literally like life-saving, potentially like medications, just because we thought that they like could try harder, you know? They just need to like work more to get to where they are. It's like, we offer health care in all different ways, whether that's surgeries, whether that's medications, I mean, whatever it is, to be able to give people tools and skills so that they can get to where they want to go. So to deny someone literally life-changing surgery like, bariatric surgery would just be so unfair. And it's so frustrating to see people who are having the surgery so judged because of having the surgery too, right? When so many people just don't understand that obesity really is a chronic disease.
Yeah, and honestly, the quote that you said that just really stuck with me is that honestly, these people are just tired of working so hard rather than like instead of them just not working at all, they've been working so hard that they're tired of putting in all this effort but not getting anything in return. And yeah, just definitely I I'm glad that we're emphasizing this part of the discussion with bariatrics just because again the integral role that dietitians play and are able to play in bariatrics and the kind of compassion, understanding, and perspective that we need in order to properly treat these patients and to not judge them and to give them the proper care that they need because yeah, like if someone has hypertension, you're not going to deny them like lisinopril or any drug or anything that they may need if they've already tried like a DASH diet, exercising. Like if they've tried everything in the book and they still have high blood pressure, you're not just going to say, "Oh, you didn't adhere to the diet enough, so you're not going to get this medication yet." Like it doesn't make sense. And so I'm glad that kind of you're saying that the shift in the narrative of treating obesity like a chronic disease is important because I mean, these types of treatments can change people's lives forever and for good and all that good stuff. And so, kind of going more into the private practice, and like you kind of definitely shared your interest, your desire, and the passion that you kind of have for being a bariatric dietitian. And so, can you kind of describe more about like what made you decide to pivot to start a private practice and what kind of having your own private practice has done for you that working in a bariatric clinic didn't offer for you?
Yeah, and there was like a few different reasons for it, but you know, part of it whenever you're working for, in like a hospital institution or whatnot, right? I mean, you are kind of working within some red tape, right? So what you can do with people or how long that you can spend with them time-wise can be really limited. And so again, like with these patients who are having this surgery, obviously this isn't just like a one and done, like here's some information, like good luck, you know? I mean, there's so many different phases to the bariatric journey, both pre and post-operatively. And, really it can, like I said earlier, it can take months, if not years, for people to really get to their goals and to a place where they're trying to like live in maintenance. And so it's so nice to be part of that entire experience, right? And to really get to know people really well. I know there's some clinics out there who are just, it's kind of just like this revolving door of just getting people in and like, good luck, see you later, find your resources where you can. I was really fortunate to work with, clinics who did offer a lot of comprehensive support and, really did try to follow up with people pretty closely post-op, but that's not always the case. And so as I was, working in this field, I spent 7 years working in hospitals and clinics, and it was great to see people, but I wanted to help people more, right? Seeing them 3 times a year sometimes. You got this like little snippet of like a check-in on how you're doing, but you didn't really get to dive into like the process of helping them and supporting them make the changes to get to where they wanted to go, right? And so I really wanted to provide more support, more definitely like close-knit support, and also honestly like have more time with my clients. Every year there was this push to cut back on visit lengths. And I started my very first bariatric job. We had 90 minutes for our initial session, and it was great. We had so much time to work with them. And then our follow-ups, I think, were like 45 minutes, which was wonderful. And then as I kind of got further and further into my career in bariatrics, the appointments just got shorter and shorter. So it was like a 60-minute initial visit, and then, a pre-op visit was like 60 minutes, but then that became a group. And then like post-op visits were like an hour, and those became 30 minutes. And then there was like a push to make them like 15 minutes. And it was just like, like I just felt like I couldn't help people, who desperately wanted and needed it. So there was a little bit of that push of like, I just want to help people more. But then there was also just kind of the aspect of, I don't necessarily want to work for anybody else. I want to be able to make my own schedule. I want to be able to like choose my own hours. I don't necessarily want to have to spend 2 hours commuting every day. I want to be able to take time off whenever I want to versus like having to, at the job that I left when I decided to like quit and start my practice, I got a total of 10 days off a year. So I was like, okay, between like a mental health day and like some travel around holidays, like I guess I just don't ever get vacation.
You just can't get sick.
Yeah, yeah. And so I was like, I love what I'm doing, but I also want that like work-life balance to be able to like, take care of myself too, right? And I actually was also looking for opportunities to grow within the organization and, how can I make more of an impact, right? Whether that's in terms of being able to like manage other RDs or just grow. And honestly, I was basically told like there's no room for growth. Like there's no, like dietitians are just dietitians. Like there is no other step. And I was just like, that's from where I'm at in like my career, like, being at this point in time, like my early 30s, I was like, um, I mean, that's it. Like this is it. This is just the rest of my life. Like, and I was basically tapped out on pay as well. Like I had like hit the ceiling of pay. I had hit I was like, and I feel like I'm a very like ambitious person. So I'm like, well, okay, I just like crossed the finish line and that's it. So for me, I was like, I think I need a new challenge. Right. And so starting my own business like really checked a lot of those boxes of being able to have a new challenge, to be able to set my own pay, to, set my own hours, to make my own schedule, to learn new things, to help more people be more impactful, right? And yeah, and so I made the jump, and it was very scary. And I will say private practice or being an entrepreneur is not for everybody. Like it's not, I probably actually work more now than I ever did. But I truly do love what I do. It's a lot of hard work, and it's been a huge learning curve to learn the whole business aspect of things. But I'm definitely very happy that I did it.
But the additional question I kind of wanted to expand on with you starting your private practice is what that process looks like, because we were talking about before the recording how they don't really talk about starting your own practice in undergrad, and also how it's like definitely not for everyone. And so kind of like, could you share your process of how you, now we don't have to go into the legalities of, which paperwork you signed or things like that, of course, but kind of like how you knew starting a private practice was a good fit for you, and kind of how someone can discern whether or not becoming an entrepreneur is a good fit for them. And then like what the transition was like for you. Like, were you building your practice as you were still working, or were you like, I'm it, and then I'm just going to throw everything into this practice? Can you kind of share, starting first with how you knew it was the right path for you, and then how the listeners can maybe also discern whether or not it's a good path for them in the future, and then just kind of your transition from working in a bariatric clinic to starting your private practice?
Yeah. So I kind of had, I think this was around 2017. So at this point in time, I had been in bariatrics for only probably 4 years. Um, and I actually I had this like interest in doing like food blogging, like making recipes and whatnot. Because a lot of my clients, like they jump on Pinterest or they go online, and there was like really no resources at all for any surgical patients at all. There was like two websites that I can remember that produced some content, but this was like even there was social media. I mean, there was Instagram, but this was like the days of like you just post like, and there's like hashtags. Like there's no reels, there's no like Instagram stories. There's like it was just this like feed, right? And you just saw like the last person to post. So different. And so social media just wasn't where it's at now. There wasn't many websites, there just wasn't many resources. So I was like, okay, cool. I'm gonna like start like a food blog. I make bariatric recipes and like start just offering that as like a resource for the patients that I'm working with. And so I started kind of dabbling in that. And then I kind of just like got this itch to like jump on social media. So I started an Instagram account, which I called my bariatric dietitian, and started posting recipe ideas and just like making some content. And at the time, there were literally two of us. We call ourselves like, well, we don't really call ourselves, but other people call ourselves like the OGs of the bariatric online world, because there wasn't anybody out there. So that's Kristen Willard from Bariatric Meal Prep. Her and I like started like talking on Instagram and like met each other virtually, and like, saw each other's like businesses kind of like grow. But at the time, like we were just kind of posting kind of random stuff. Like there was no strategy to any of it. But I did start getting inquiries from individuals who were looking for extra surgical support, and, asking for more resources and asking for, just more information in general. And so I actually did start offering like just random, nutrition sessions with people locally. And I would actually like rent like a WeWork desk, like a little office space for like an hour and like have people like meet me And of course, I had like all of the, business license and all that kind of stuff set up, but I would just do it after work. Like I'm in Seattle. And so I would like go down to downtown Seattle, like near my hospital job, and like take a client or two here or there. And it was great. But then all of a sudden I was like working nights, and sometimes I'd work on the weekends, and it wasn't very sustainable, but I did enjoy it. And so again, I started like doing my website, and I was, doing these random consults and kind of growing things. And my boyfriend at the time, now my husband, he was like, I think this has legs. Like, I think that, like if you're into it, I think you could do something with this. And I think part of me kind of like doubted it, or was like, I don't know, like, when am I ever going to do that? How do I do it? Like, there's no instruction manual for any of this. And again, at the time, like, there isn't like, the resources that we have nowadays with like so many great, like, kind of entrepreneurial or even like business coaches for dietitians out there now. Like, there was none of that. And so I kind of just pieced things together, but really for like 3 years, it was a side hustle. It was posting randomly. There was no strategy to it. It was randomly seeing people. And I was definitely getting my feet wet. And I definitely was really interested in it. Um, and then really like what kind of all came to head was I wrote a cookbook in 2019. It was a bariatric cookbook. And that whole year, just everything kind of exploded. The cookbook did well, that got published. I was growing really fast on social media. I started getting more inquiries, to work with me. And I, at that point, was doing things virtually. So I could see more people. But again, it was like all outside of like my normal business hours. And then, yeah, and then there was just kind of this, I won't go into the details, but there was just kind of this moment at my job when I was like, I don't think I can stay here anymore. And I decided to leave. And my fiance, again, now husband, was like, I think that you just need to make a decision. Like, you need to decide, are you in or are you out? Because if you're in, let's go. If you're out, you need to like wrap this all up and like not have this stress of this like extra work on the side, like pick a lane. And luckily I mean, he was very supportive. I don't think I could have just quit my job, number one, without his support, but also without his financial support in that sense too, right? Like, he got me on his insurance, and like we were living together. And so he knew that there was going to be probably like this time period where like I wasn't making as much money, but he was very supportive of that. And so, um, yeah, I was like, okay, like, he's like, if you trust yourself, if you know that you believe in you, that's all I need, like, as long as you believe that you can do this, like, let's go. And so I was like, yeah, like, of course I can do this. Like, I know that there's a market for it. I know people are in need of this. I know that like I have a passion for this and I want to have my own business. So like, let's do this. So I put in my notice, quit my job, and like a month later, I was my own boss. It was very scary. Literally 1 month later, the world shut down. So this was February 2020. And I was like, what did I just do? This was probably a horrible decision. And it actually turned out to be fantastic, right? Because everyone was virtual, everyone was at home. A lot of people who had been getting support no longer had support from their surgical team, or people were, this was an elective surgery, right? So elective surgeries were on hold, but a lot of people wanted to like keep the momentum and make sure that they were like getting ready for when they were going to have surgery. And a lot of people were looking for like online resources. And so here I was on social media. I had a website already, and, had already been doing, discovery calls and that sort of thing. And so, yeah, I started getting things in 2020, just like kind of built up. But I would say like, I didn't know it was going to be a good time, like I didn't know that all the stars were going to align. It was just kind of like, I knew what I wanted and like, I was going to figure it out. And so, I mean, I'm still learning to this day about how to run a business and how to grow and like all the ins and outs of things. But I love it too. Like, I love that challenge of it. And I love the learning process of it. And I honestly like love so much of the business aspect of it that I didn't really know anything about. So that was my really long-winded answer. But yeah.
No, it's all good stuff. Yeah, because, and I'm glad that you shared just the whole process, your thoughts, your feelings, the support that you had, how it was definitely like a slow, like dipping your toes in it before fully diving in. The lineup of how things coincided with COVID, how that pandemic kind of turned into that blessing in disguise for your business in the sense. I'm not grateful for the pandemic. I'm mainly talking about, the situation that it presented itself with.
Yeah.
Um, but it, from what I heard and from what I was hearing from you sharing, is it was a culmination of years of you dipping your feet into something that was genuinely leaning into what you liked about bariatrics, but being able to emphasize on what you liked about your clinical job. Um, and kind of how it spanned out is that you focused on like building your network first and like finding an audience, finding the need, and then kind of building your business off of that need and off of the audience. And kind of knowing yourself, and you knew at that point because you'd been dipping your toes in it for 3 years that it was something that you were interested in and that you didn't want to let go of. And so it was definitely not just like you woke up, I'm gonna start a business, next day you quit, and then boom, you had a business. It was definitely like a slow churned, thought out decision. And so then whenever it comes to like someone who, or like an aspiring RD who may want to start their own private practice, from what I heard, you knew that you wanted to start a private practice and that it worked for you because of like what opportunities it presented itself with, and kind of it helped you emphasize the role that a dietitian played in a bariatric setting, but you were your own boss. You were able to see your patients for and clients however long you wanted, and you were able to have a lot more autonomy in what you did. But for kind of those people listening that may be interested in starting a business, like what advice or what things would you want them to know to kind of help vet whether or not starting a business, being your own boss, would work for them or not work for them?
Yeah, I mean, and there's also so many different avenues to take too, right? And so I think kind of the first step is really to just start thinking about what you might want to do, right? And in terms of like, do you want to work with people one-on-one? Do you want to like just make recipes? Do you want to have like a membership site? Do you want to do groups? Do you want to do programs? Like, there's so many different things that you can do. And so I think just really kind of, exploring what makes you happy, whether that's the type of clientele that you work with, but also like, how do you want to support those people, right? And there's just so many different ways that you can do that. Like you can be so creative, but you have to also recognize that there's a lot of hats to wear in running your own business. And so, until you hire individuals, you are the dietitian, yes, but you're also the marketing expert and you do all the bookkeeping and, you have to send out the emails and do client, support and the technical stuff. So if you have like a electronic medical record system and your client doesn't know how to use it, like you're trying to help troubleshoot, or I mean, you're doing everything. And I think for some people, they could probably very quickly answer if that's any interest to them at all, right? Um, I would say that if you're not like scared of doing any of those things, then maybe running your own business is something that you might want to do. But I would say, there are some downsides to it. I mean, you don't get paid time off, right? So if I take vacation time, unless I have a way to, you know, um, get, money passively, or I have like reoccurring revenue, right? Like you're not getting paid for your time off. And also like you're not necessarily getting health insurance. So again, like I was fortunate to be married and like be on my husband's insurance. And so that was like a great thing too. But there's definitely a little bit of like financial cost to get set up. I wouldn't say like the overhead is wild, but there's the financial aspect. You have to think about, your needs in terms of like healthcare and, the lifestyle that you're trying to provide for. And that can be difficult. So that might again take just like some ramping up to be able to get to that point where you can quit your job. You might have to do a lot of stuff on the side until you can build that up. But I would say like if you just have this like, I don't know, for me, it was just like this gut feeling. I think that that's honestly what it is for a lot of entrepreneurs that I talk to, is really you just have this gut feeling like that this is what you want to do. And I will always say too that what, how you start your business is not the way that your business is going to look down the road too. So sometimes just starting super, super small, just starting with something, you're not going to have all these like grandiose systems and programs and products from day one, but you really just have to start with something and just be really open to the growth process of it all, like the messy imperfection of it all. I am such a perfectionist. I love things organized and neat and tidy and just tell me what to do and I'll do it. And that is not entrepreneurial world at all. And so, it's about just showing up and trying and learning and growing. And I would say that, if you have that urge, that gut feeling, go do it. But honestly, it's also so fine if you're like, yep, that's not me. I am not that person. I am not the kind of person that's going to like go do all this business stuff and like spend all this time learning and managing all of these other systems. Like I just want to like show up and like be the best at my job and like have my 401k and have my like paid time off and that's fine, like there is definitely a wonderful aspect to all of that. So, I think that there's just so many like options these days for individuals. But if you have that like gut feeling, I'm always going to tell you to go for it.
Oh yeah, no, definitely. And honestly, yeah, gut feelings do. We kind of like to get stuck in our head analysis paralysis or being like, oh, what's the best calculated perfect response? We're really, again, starting somewhere. Like for you, you just started renting out a room, consulting patients or clients at your while you were still working your main job, and then it grew into what it is today. And kind of this is like the last question before the final kind of like call to action question I like to end each episode with. But whenever it came to growing your following, kind of growing your audience, and also the success of your cookbook, because from what I gathered, was the cookbook kind of a culmination of your blog recipe posts kind of going into fruition, or kind of whenever it came to marketing, yourself on social media or marketing your cookbook, making your cookbook successful. Can you talk about the kind of captivating an audience aspect of a business, and just kind of like, it's okay if it's something more so like brief or advice driven, but kind of like how to get an audience in the first place? Because I mean, that is what runs your business, and that is a big proponent to what makes it successful and sustainable, is having a very good presence of your business. So if you just have any advice or like places where people could or should start in order to get that audience cultivating, and maybe talking about your cookbook process, how that worked, things like that.
Yeah, I would say like to one of the misconceptions that I had was that maybe not even a misconception, but I had this idea that like, I went to school, I learned how to, support someone with heart disease. I learned how to support somebody with type 2 diabetes. I, worked in a dialysis center in my internship. I had all these skills, I had all this knowledge, and I could help everyone. So why not help everyone? Right. And I just had this idea that like, Well, yeah, I'll work with individuals who have diabetes, and then I'll also work with people who, are pregnant, and I'll work with this person and that person because I've been trained to be able to support, all different types of individuals and goals. But the reality is most successful businesses help 2 to 3 people max, meaning like they choose to support a type of person and the goals that that person's trying to achieve. So, I think that there was a lot of fear that went into, well, like, well, I don't want to niche down. Like, why can't I help everyone? And so truly like my first like website was like, I help people with, and it just like listed all these things with type 2 diabetes and, you know, X, Y, and Z. And like I had this whole list of all the people I could help. But in a way, I was helping no one, right? Because I wasn't really pinpointing that person, one person who needed my help. And I just thought that by really niching down and focusing on, again, 1 or maybe 2 or 3 types of people and the pain points that they have, I thought that I was going to be missing out on business, right? Like, how am I ever going to have enough clients if I don't help everybody? But the reality is that there are so many people out there who want and need nutrition help. And it's so much easier to be able to help and talk to one type of person or 2 types of people, or even maybe even 3. And so niching down actually like totally opened up my whole world, right? Because your messaging can be so much more specific and focused. It's easier to speak to one person and their pain points and their concerns and their goals versus trying to talk to absolutely everybody. And so after I chose specifically, I was just going to, focus on working with bariatric surgery patients, right? Like that became my niche. But really, in that, you have so many sub niches. You have people pre-op, you have people post-op, you have different ages, right? You have people who are maybe menopausal, maybe people who, also are dealing with like ADHD. Like there's so many different types of individuals within the world of bariatric nutrition that really there can be sub niches in this niche area. And there's so many people to help within those sub niches. And so what I really learned was like, it's okay to just talk to a group of individuals. And the really nice thing about that is not only can you message so much easier and more clear because you're talking to one person, but they also feel so much more heard and understood because you're using language and you're talking about their specific problems. And when you have that type of connection with your audience, that's when you really build that trust, right? Like that know, like, trust factor is like when they feel heard and understood, right? And you can really connect with them on that level of like language, a lot of doors open. And so I feel like a lot of, growth on Instagram or even like with my cookbook, like being able to speak to your audience and connect with them is, it's so fulfilling, number one, but it just really helps you to elevate your business too and grow. Because I think there's just so many people out there who can connect with that message and that problem that you're trying to solve and help with. But sometimes we don't feel that, right? We feel like we should be able to work with everybody. So that'd be like my biggest thing is, and obviously, you never have to stick with a niche forever. You can always change, who you want to help and what you do. So that can even evolve over time. I mean, even, historically, I've worked with people pre and post-op, but I would say nowadays, a lot of the individuals that I work with are post-op and like specifically like, they're either newly post-op or they're like more than a year post-op, right? And so even those are sub niches. And so those are like the 2 individuals that I mainly work with are like immediate post-op and like, more than a year or more post-op. I don't really work with that many people pre-op anymore. And it's not because I don't like to, it's just because often they're going through their surgical center for that. They're not really reaching out to someone online for that. Um, but also again, like that would be a third type of person to be talking to, right? Someone that hasn't even had the surgery. And um, but yeah, I love working with people in the post-op stage. So I think it's just really getting clear on who you want to help and learning, the types of things that they struggle with, their pains, their problems, what they desire, what they want their goals to be. Like I actually don't even make the assumption that any of my patients want to lose weight. I mean, I know that most of them do, but I don't ever assume that, like what do you want from this journey? What do you want that to look like? So getting just really clear, having conversations with individuals, in your niche, learning more about what they struggle with. If that's something that you haven't gone through yourself, I haven't had bariatric surgery, but learning about their struggles, learning about their goals and desires, and then it can be so much easier to connect with them too once you learn what they want and need and how, of course, you can support them with all of that. So I think just growing your audience and really elevating everything is just starting with talking to one person.
Yeah, and I'm just like that's such great advice of like knowing your audience and knowing what you are selling, like what service you want to provide. And I'm glad that you included the nuance of even whenever you niche down, it's not necessarily that like you're isolating yourself. It really opens the door because that means that you're able to specialize, you're able to actually address people's needs more specifically, and you still get great experience go like focusing on one niche because again, you have pre-post-op, someone could have comorbidity, someone could have hypertension that you're also dealing with, diabetes, someone like they could have so many other different things even whenever you niche down. And um the final question that I kind of want to ask, and it is like a call to action, whereas say that someone may be interested in bariatrics or starting their own business or maybe writing their own book pertaining to the field of dietetics, just if given your experience and the things that you've learned along your own journey, is there anything that you would want to share to aspiring RDs that they could maybe start doing now, start thinking about now that could set themselves up for pursuing either of those paths or any of those things in the future?
Honestly, like my biggest recommendation is just to, network, to talk to as many people as you can. Like again, like I didn't really know much about bariatrics until my friend had it, and then I actually got a career in that in that. But everything I learned, on the job. Um,
Mhm.
well, I would say most of it. And so, I think just giving exposure to a lot of different areas of nutrition can be really, really helpful. And getting exposure to other people. So whether that is reaching out to people on Instagram, I mean, anyone is welcome to send me a message. I'm always happy to answer messages about what I do or about bariatrics. But just trying to make those connections so that you can figure out what your passion is. And then from there, just trying to get more exposure or more experience. And again, for me, I didn't have any bariatric experience when I got my job, right? Like I learned all of that as I went. And so, it's important just to not hold yourself back just because you don't have maybe the knowledge or experience. But also don't feel like you have to go and take a bunch of courses and read a bunch of books and get certified and all these things before you can ever do anything. I mean, I'm not certified in entrepreneurial, like business. Like I was not certified in, obesity or weight management or bariatric nutrition before I got my job, so sometimes you just have to like take a step and figure it out as you go. And that's not always comfortable, but anytime that you can, you know, interact or reach out to people, whether that's other dietitians or, going to workshops, going to conferences, meeting people, just so that you can get more exposure to like what is out there. And then maybe even get some like mentorship as well. But if there's something that you're interested in, I would just say first and foremost, just like see where you can go and you can get the experience, like just jump in. Um, or if you're just not even sure what you want to do, like just start talking to people to see what they do. Or obviously on this podcast too, like with all these interviews, you can go through and hear what other people are doing for their careers. But there's endless opportunities, and really you can make whatever you want out of it. So that's one of the really cool things about being a dietitian.
Such a great thing to end on, and I could not agree more. Thank you so much, Megan, for just sharing your path, your journey. We spent a lot, I really appreciate the time that you spent just sitting, talking about the nitty-gritty of your experience as a bariatric dietitian, how you got to where you're at now, building your business, all that good stuff. I know for sure people will learn a lot from this episode. So thank you so much again for talking about all of it with me.
Absolutely. Yeah. Thanks for having me.